So I think it's working now. Okay, it's a pleasure to be speaking with you all tonight. My name is Christopher Palazzo. I'm the Director of Marketing for BookJane. And at BookJane, we are a healthcare tech company, a platform that helps large healthcare organizations solve their labor shortage. And that's what I want to speak to you a little bit about tonight. I want to talk a little bit about work, and not just any kind of work, but meaningful and impactful work, and above all else, purposeful work. Now, before I took over the head of marketing position at BookJane, I was a professor at Humber College, where I taught sustainability and entrepreneurship courses. And before I launched my lecture series, when it came to my entrepreneurship class, I always started with this quote by the famed writer David Graeber. So let's read it all together. Huge swaths of people will spend their entire working lives performing tasks that they believe to be unnecessary. The moral and spiritual damage that comes from this situation is profound. Above all else, it is a scar across our collective souls. Now, don't get me wrong, we have all done tasks that we feel unnecessary. God knows, I had 3 meetings today that I wanted to shoot myself as being a part of, right? But let's ask ourselves, how many of us can truthfully and unequivocally say we are doing work that is truly purposeful and impactful? Let's raise your hands. I'm not going to throw a pen at you, so raise your hands. Okay, good. Well, you're all a bunch of tech founders, so the hope is that you are doing purposeful work. But the person that I feel best exhibits this notion of purposeful work, which when I first saw that quote, struck me as a young student, changed the trajectory of my life, because I made the decision to only pursue work that was purposeful. It came to a highlight earlier this year, once I took over the marketing position at BookJane, when I interviewed Jessica Bailey, who was one of our customers. She's a personal support worker for Amicapeel Village, and oddly enough, this is the first marketing campaign I ran for the company. Now, for those of you that don't know, a personal support worker is an individual who predominantly works for the senior care side, who helps seniors live a great quality of life, whether it's changing them, feeding them, getting them up in the morning, that continuity of care. When I asked Jessica a very simple question, which was, why are you doing the work that you do? What provokes you to do that? Very simply, she said, I enjoy helping people. That's what gives me the greatest sense of joy. Now, when it comes to Jessica and the issue of helping people, it takes on a different notion because Jessica works with Alzheimer's patients, right? The level of care and help that is required for that is astronomical. But she still does it every single day. And during my time at BookJane, I've had the pleasure to speak with dozens upon dozens of care workers who are just like Jessica, who do this kind of work because they love what they do. It's a continuity theme when it comes to the healthcare space. But there's an issue here. People like Jessica are not finding work. This is a crisis that no one in this industry is talking about. Few of us actually openly discuss it. It is hard for people like Jessica to find adequate work. 4 million, I know it's a little bit bright here, but 4 million, that is the number I want each and every one of you to think in your heads. That is larger than the population of the city of Toronto. 4 million in the United States alone is how many care workers are going to be required in order to provide adequate care for the United States aging population. There is no plan to gain those people. None. This is not an Ontario issue. This is not a Canadian issue. This is a global issue that's affecting all of the developed world. Now, there is a federal campaign happening right now here in Canada, same across down the border in the United States, and Ontario had one recently. And let's ask ourselves, people talk about healthcare on the election, on the campaign trail, but how many of us actually hear about this issue of support workers and this crisis that we have? None of our politicians are talking about it. It's funny because the reason why we got into this issue in the first place is because of chronic undercuts and funding lacks. People are leaving this industry, these workers like Jessica are leaving because they can't find adequate work. They're not making enough money. Organizations are cutting their staff. So, I'm not a politician, and I can't advocate for policy change. Well, I guess I could, but I have no interest to. I'm in the tech space, and I believe that technology has a role to play in this. And we at BookJane believe that we can empower workers through technology. And this is the key here. We believe that allowing workers to choose when they want to do the work that they want helps to solve this issue. And our numbers speak for themselves. Workers like Jessica are accessing 40% more hours. For the organizations that we work with, which as of right now is over 700 globally, we fill over 90% of the shifts that come through our platform, and we're growing every single day. At the end of the day, we save time and money for the resources-strapped healthcare facilities, which is fundamentally important. We're not advocating for change, so we're gonna operate within the boundaries set before us. So what is this benefit of a gig economy style of work? A lot of people harp on it. Let's talk about it. What's actually good here? Number one, it works within limited budgets. You're all in the healthcare space. You know what it means to be in limited budgets, right? Flexibility that the workforce of tomorrow desires. How many of us don't want to work 9-to-5 jobs? We don't like that. We like the ability to set our own schedules. And finally, it gives the variety of work that we crave. The days of working that one job that my parents had, and I'm sure most of your parents had, where you had that one job for the last 30 years, that doesn't really sound that appealing to me, and perhaps doesn't seem that appealing to you. So we believe that we can advocate real change through technology. That's how we feel we are delivering better care. Thank you. Questions? Oh, well, that hand went up fast. Come follow me.
How do you vet your PSWs, and how do you ensure that the PSWs are safe in the homes where they're working?
Good question. So for all of the caregivers that are on BookJane platform, which as of right now is numbering in the thousands as of right now, we have an entire recruitment team. We follow ministry guidelines, and we ensure that they will apply on through our app. They submit all the documentations that's required through our app, and all of our teams will ensure that they meet those requirements. And that's not all. Not only do they have to meet those requirements, they actually have to undergo BookJane training. So we train. We have modules, online modules that all of the PSWs, as well as our nurses, have to go through before they're actually allowed to accept shifts on our platform. Yeah. Correct. So when it comes to the home, that comes down to our partners or the clients themselves. So if it's a new caregiver that is, for instance, entering North York General for the very first time for the first shift that they're accepting, we actually will speak with North York General, and we actually would recommend doing a 15 to 20-minute training session beforehand. So the caregivers that come onto the platform are able to learn some of the more peculiarities about that particular location when it comes to safety requirements. Okay? Thanks. Yes, go ahead. Sorry, say that again?
Does anybody hire you directly in their home, or are you always going through organizations?
Are you talking about direct patients?
Yeah,
or?
so like as an example, a big gap in care and coordinating care like this is when patients leave the hospital, they don't get enough funding through the government for PSW hours. A lot of time they're directed by people like myself to pay privately for care. So is it always through a care organization like, say, St. Elizabeth Health or something that you're going through so that, to his question about safety in the home, they're dealing with it, or are you ever directly dealing with a home and family?
Correct. So we exclusively are a B2B organization, so we directly deal with the organization. So when it comes to at-home care, we will deal with the at-home care organizations that are providing those PSWs. That was just a strategic decision that we made as an organization that allowed us to help us grow much more faster, as well as B2C, there is some different limitations when it comes to that. But I do understand where you're coming from, and for those of you that don't know, home care is actually a huge issue. We're dealing with them when it comes to the organizational front.
But then that organization is the one, if there's a problem in the home or funding, payment models, they're the ones dealing with it,
exactly.
not you.
But we do work with many at-home care organizations to fulfill their to provide their technology, exactly. But we're not dealing specifically with that patient.
Right.
That makes sense? Okay, great. Question?
Oh.
Yes.
For the support workers and nurses that work with through your organization, are there concerns about, I guess, their lack of rights or ability to form any kind of, I don't want to say, not necessarily the word union, but, in terms of being able to protect their rights, and the fact that because they are individuals, they don't necessarily have any insight in terms of pay equity and pay increases over time because they're gig workers.
Okay, so I understand what you're saying. I don't agree with everything that you're coming forward. First, at the end of the day, we don't force anyone to work on our platform, right? We're giving them the opportunity to access the work that they want to work at. And when it comes to the issue of pay equity, we actually pay above average pay at BookJane because we understand the issues that workers face. And we love each of our caregivers that come on our platform. And we don't want to be like every other sort of gig economy organization out there, which is perhaps undercutting the workers. So we actually do pay above average. We also have incentives and bonus programs in which the more shifts that workers work, the more pay that they have available to them. So we do incentivize our workers to make it feel like they are part of a large organization. At the end of the day, if workers can't have access to full-time work and we're giving it to them, they're going to take that. So yeah, question.